everybody, and welcome to Spotlight Interview with Action Coach Performance. We've got another great entrepreneur guest with us today, Mohamad Matout. Welcome for being a guest on the Spotlight Interview.
Thank you so much for having me, George. It's really an honor to be part of this interview.
Our pleasure. So, Mohamad, you've done a lot of work in the psychiatry space, psychology space. Can you talk to us a little bit about what you're currently doing, and maybe give us a little bit of background of what inspired you to do this?
Yeah, so yes, you're right. Actually, my work has been mostly in the mental health space. By training, I'm a psychiatrist. So I actually completed my training just last summer. I was done with my training to become a psychiatrist. Um, and currently, I'm actually pursuing a fellowship, which is subspecialized training in interventional psychiatry. So it's a newer branch of psychiatry that deals with treating mental illness, severe mental illness, with interventional approaches such as electricity, non-invasive brain stimulation, and other newer form of therapy. But throughout my training, there was something that I was always, curious about, and it was how to treat the most severe patient that suffers and that we see in our clinic, where sometimes treatment can be limited. And so, this brought me uh, to look into mental health innovation and to think about mental health innovation, and led me with my team basically to work on AVAtalk Technologies Inc., which is basically a company whose goal is to make accessible avatar therapy. So that's overall it.
That's really ambitious for someone who's just getting their educational credentials done. Um, the obvious train or track for most professionals such as yourself, is to go into the public health sector and serve and work with people. Where does this entrepreneurial drive come from? Like, do you have family that are entrepreneurs, or what was it that sparked the entrepreneurial drive?
That's an interesting question. I think that it really came out of a desire to provide change. And no, there's not really anyone in my family that has, this entrepreneurial spirit. But when we grew up, we grew up with very little means, and when you grew up and with that mindset, I think you oftentimes try to be creative, figure out things, figure out ways to do things. And I think this is at the spirit of entrepreneurship, in the sense that you don't accept no for an answer. You always try to find a way to do it. And that's what it was, basically, the parallel that I can make, when we came up with AVAtalk technology. I was in the clinic with Dr. Gail Meyer, and we heard about avatar therapy being used in the UK, but yet there was no way of using it and making it accessible. You needed like this VR setup that was expensive, and the technology that we didn't have. So I was like, why don't we just use a phone and do it? And from there, I didn't take a no for an answer, got the right people, and then like we started working on developing this digital representation of the voices that a patient with schizophrenia hears, so that a therapist can work with it. And it's been a journey, but I think this is where it comes from, is out of a place of curiosity, creativity, not taking a no for an answer, and wanting to move things forward.
That's amazing. So I'm hearing impact. You wanted to figure out a way to have bigger impact. I mean, we all know that there's a shortage of mental health professionals out there, and there's a massive demand. So this is great. I see the logic there. From an entrepreneurial point of view, you're trained as a psychiatrist. You're not trained as a business person. What were some of the early challenges that you faced from a business perspective to turn your idea, your vision, into a practical reality? Like, so you talked about team, The obvious one, of course, is finances. Where do you get the money to make this happen? So why don't we talk about teams? So what were some of the challenges to get other people to kind of join you in your quest?
Um, Again, very, very good questions that you have, because these are like so many challenges that you face. You're so right. And I think though that's interesting. Not having a business background may be a good thing sometimes.
Mm,
And I'll explain myself, at least for the idea generation aspect of things. I think if I went with the mindset that I wanted a business out of it, I don't think we would have been able to come with this idea along the line, because the way it started is actually started out of a way of, we want to use this thing in clinic. We want to be
mm.
able to use it. How do
Get it?
we get there? Initially, it started as a research project. Then it moved more towards like, okay, if we wanted to have an impact, if we wanted to be able to materialize, there has to be the component of business, because this is where business drives innovation. And, coming up with the team, I was very fortunate. I mean, I think, timing is so important in anything we do. And at that time, like I was in my second year of training to become a psychiatrist, and I was working with Dr. Gail Meyer, who's a cognitive behavioral therapy expert, very known at the national level for the work she does. And she was open to new ideas and innovation. And we were just discussing, and we had this patient we were doing therapy on, but then we were like, what if we had this technology that we could use?
Mm,
She was open to it. Then, I started looking, and I think this is so important to recognize talents in other people.
mm,
Like we have to realize, and that was actually true for me, to realize where my limitation are. I knew I had zero programming skill. I'm curious, I like to read about stuff, and can talk a little bit there and here, but not really like mastering this skill. No. So I went, did some research. Then I had this friend around me that we were previously talking. Then I reached out to him, and I was like, listen, like there's this project. I know you're brilliant. You've basically had this award from Apple when you were 16 years old for building this app, and you were recognized for it. Do you think you could do this? He's like, yeah, that's like interesting, and it's a challenge,
nice
and
to
then
have a
so he
friend
got
like
on
that, eh?
board. And then gradually it was really, really nice. But what's interesting is we became so much closer through that journey, because when we started, like he was programming, I was in healthcare. We were trying, to make time and everything. But then this journey basically brought us together, and the friendship also evolved. But what's interesting is as we moved forward, we started having more challenges. So the business aspect of things started to be important. We were lucky because at McGill University, there was really this there's really this hub and this environment created for you to help you if you have an innovation, or an idea that you want to push forward. So we were, initially with the McGill Dobson Center. Then later on, we went with the Neurosphere that also helped us, currently continuing to help us. And actually, a lot of the funding came from these institute and also the Montreal General Hospital Foundation. So which believed in us, believed in the project to start, and then moved it forward. And then when it came to having business people, then we went back to the drawing board as a team, and we were like, okay, who can we bring on? We were lucky, to Gail also knew. So one of her friend is so Krista Payne, who's part of the team, and Krista is also a VP at Thermo Fisher. So that helped. She had this business strategy that she could help us with, and we have OC Williams, who joined the team as well and has experience, in startups and in building businesses. So that that really is, I think, how you should go about it is don't be scared. Along the way, you will find the right people that will complete the team. And it's the journey and the process that you have to work with, not expecting results right away.
I love what you said earlier about, maybe not having a business background was a benefit to you in the sense that, when you have a business hat, the first thing you think about, oh, how do we monetize? How do we monetize? but you were focused on the problem and figuring out a way how to solve the problem. So that was probably a good thing. The other thing I heard was that you didn't get stuck in that rabbit hole of trying to do everything yourself, like trying to be the expert at everything yourself. You were mature enough to say, wait a second, I need help. And then you reached out to people the best people that you knew. And obviously you're a good student in the sense that, it's one thing to reach out to these people, but it's another for these people to accept to work with you and to continue to work with you. So clearly you're the kind of person who listens to advice, you take their counsel and you apply it, and it makes them want to continue to work with you. And I think that's an important lesson that entrepreneurs, especially new entrepreneurs, can take, because we can't do it all, and we have to listen to the advice of the people that we reach out to.
Yeah. And you'd be surprised how many people around you have, done things or have experience, and they're willing to share it, but yeah, along the journey, this is what happened, whether it's in the team or outside of the team, the amount of people that we've met that were just so helpful is, yeah, it's impressive.
Yeah, you used the word luck and lucky a few times, and yes, luck does play a part in business. We know that. But I think you put yourself in the right position. You aligned yourself with McGill. That's a good, obviously gives you a lot of advantages. So that's good. And you pay the price for that. And you had to work hard to get in, and you have to work hard to stay in. So yes, there's luck, but there's the contribution that you make for sure. Along that line, did I not see something about Stanford in your profile? Are you working with them as well?
Yeah, so currently, actually, so my fellowship. So the way medical training usually works is you do medical school, then you do your residency. That was my psychiatry residency, and then you do a fellowship, which is subspecialized training. And currently, I'm doing my fellowship, so in interventional psychiatry at Stanford. And along these lines, hoping to work on the front of AVATalk Technologies, because the reality in healthcare startups, it's very regulated. So you need to run studies to show that your therapy and I mean your product is safe, to show that it's efficient. All of these things will help. So, working with people at different institutions who can bring it forward, that's important. And this is why, like the team doesn't stop at your little team within the startup, or it also goes way beyond. And it's important that you are open. And this is why I said you'd be surprised by how people are willing to help, right? Because people actually can see something in it and be like, you know what? We want to help. We want to be able to use this as well. And it's something that really, in my opinion, when we question if there's humanity in this world, what is interesting, because I was biased. I thought the startup people, all they care about is money, it's all that. Then I'm like, you realize that there's so much humanity, that actually there's people out there that their goal is to get things out there so that there is an impact on society, and they want to help you with that project. So that's what's so beautiful, like it's really something that is humbling, that teaches us about how we can help each other when we need each other.
Yeah, don't listen to the popular media and the Wolf of Wall Street type of thing. That's not the way real business people are, because even big business started off with an entrepreneur, and all entrepreneurs that I've ever met, they're usually driven by solving a problem. The money comes later, yes, but usually the real ones, the pure entrepreneurs, these are the ones that see a problem in the world and they say, hey, I can fix that, I can do that, and then they just get going. And yeah, so, and you know what, there is an energy that comes with that. When someone is fixed on solving a problem, it's a magnet, and it draws other people to you. Like you said, they want to help. People want to help if the idea is good, if the impact is big, if and especially if they see people suffering. And I think everybody knows somebody that's suffering from some form of mental illness, right? So
Mhm.
it's a good cause. So I really appreciate that. So what's next for you? What are the big plans? How, like in a year from now, where do you see this project?
So in a year from now, what we're hoping to achieve is we were going to be complete with, done with the trials, to basically show that our product works and that it's safe. And then we're actually hoping to get regulation approval and start to have clients. So the beautiful thing about being in the healthcare space and coming with an idea about an innovation in the healthcare space is that if you can validate it or at least get an idea if people want to use it early on because you are surrounded by colleagues. So a lot of, word to mouth in the beginning and starting with people around you, a clinician therapist that want to use this app. And then down the line, clearly looking into more, deals with government insurance and all of that, but this becomes more complicated. And this is where you see where perhaps the business experience will be more useful and the right circle, right contacts will be very useful. But again, as I've said, like I'm of those people who believe let it like take it one day at a time, and at the end of the day enjoy the process. Whether it succeed or fail, this is not in your control, but if you feel like you've been working on something important and it happens, it materializes, well, that's good. If not, I think it's still a wonderful learning opportunity, a wonderful experience that I don't regret. But I think, yeah, like within a year, this is where we're hoping to be, to have at least the product in the hands of therapists so that they can use it with their patient, and that, hopefully brings a new form of therapy that accessible so that it can be used with patients who oftentimes their main option is medication, and then when they have residual symptoms of hearing voices, we have some form of therapy, but not so much. And then this new tool, I think would be helpful, and hoping that, alongside the data portal that we're building for the app, it can help in understanding the symptoms that the patient, is experiencing and how they improve with the therapy. So hopefully, I'm hoping that in a year, because it's been at least 3 years we've been working on it, but I'm hoping that in a year, we finally get to see the impact in
That's
clinics.
amazing. So you kind of took a little bit of my next question, which was, who are the right people that you should be, like who should be listening to this? Like who would be the right people to reach out to you? Like who should be listening to, for like, should we, you mentioned clinicians, like who are the types of people that should be hearing this?
So that's so interesting, because I actually got an email recently from a patient who read about us and was curious to know when they can start using it,
Mm,
right? And so I think it comes from different levels. I think patient people who have people around them who suffer from mental illness, um, therapists, clinicians, psychiatrists, because what will happen is what will drive this demand for it will be patient requesting to have a different
right,
alternative,
right.
because healthcare should always be about patient first. It's not about us. No, for real. Like, it shouldn't be about us. Like,
It sounds
it
like
shouldn't.
it
Like
sounds like
the
such an obvious statement, but we know it's not true. Like we know it's
No,
not
this is the thing. It's not always obvious. Sometimes we do things, we feel like, oh, it's advancing science and all of that, but like, will actually patient want that? And this is the real thing. So I feel like when patient will start talking about wanting that and are aware of that there is this new form of therapy that is accessible for them, and on top of that, you have therapists, and then they align together, then this is where we're gonna see a demand for people wanting. But like, I truly believe, so it's all of these people, but also, clearly, the therapist would be our main customer target to start. But then down the line, clearly we have other ideas of clients, because the way that healthcare is done, is different. For example, with a hospital, for example, want this product in their hospitals, and this becomes a different level of this different discussions to have, for example, with the hospital CEO and all of that. But for now, yeah, it's therapist, patient, people with lived experience, family. And what we're hoping is we won't stop with schizophrenia. We're hoping to enhance and develop so that this therapy and our product can be used in different forms, and in different, kind of suffering, right? So
Right.
whether it's depression, there's been some studies now looking at that, whether it's substance use, again, offering a new tool, and the arsenal that we can use against mental illness. And this is where we're hoping to be. And honestly, what I'm hoping is that this project can inspire people in the mental health space to want to innovate,
Yeah.
and not stop, because, we see a lot of the funding oftentimes going to cardiology or oncology, but I'm hoping that people from this project will realize, listen, yeah, mental illness and mental health is oftentimes put aside, maybe underfunded, but there are people who are interested in funding it, and you just take a
And if you
chance
can turn
and
it in,
try.
if you can turn it into a financial success, I think that will also inspire people. So I like the way that you're trying not to just keep it like in the clinical setting or in the internal hospital setting, but you're trying to break it out into the wild, if you will. I think that's a really great idea. So are you saying that if someone who is a patient hears this podcast and says, I want to put my hand up, I want to get involved, what should they do? How do they do that?
So for us, what would be important is, reach out to us on my email, that would be the easiest way. I check my email every day. That would be the easiest way. We're working on our website, so there's going to be a contact form too there on our website, avatalkapp.com. So that would be the easiest way. But the whole idea is we want to be user centric, we want to be patient centric, and we truly believe, yes, the high level user is clearly the therapist who's going to use this, but then the impact it's going to have is on the patient. So we are making sure to have both of this, the basically the patient and the therapist on board, so we can discuss how to improve the app, and the product going forward. Because again, right now we have a certain idea. We did some consultation with therapist and patient, but then the goal is to every time you're going to iterate and make it better and make it better based on the feedback. So our website will be on soon, I mean, revamped soon. We already have one, but like, go on the contact form, contact us, reach out to us. We'll be happy to meet and hear what you have to say. We're building an advisory board too, so that will also be helpful, to have people with lived experience be part of the advisory board as well.
That's amazing. I really can't wait to hear about the success of this program. It's clear, Mohamad, that the work that you're doing is critically needed. And I agree with you, regardless of whether this particular iteration of the project is a big success or not. I'm sure that you will use it as a stepping stone to bigger and better things in the future. So thank you for your hard work. Thank you for your contribution. I know that all of the work is done behind the scenes and everything, and then it's only later that you get the accolades. So thank you for persisting and staying in the game and bringing this badly needed tool to the market.
And thank you, George, for real, for making this a possibility for people to share their experience. Because I think oftentimes we hear the success stories and we think this is what it is, but then when we are through the process, like what we are at AVAtalk Technology right now, we're still in the process and building. I think it's nice to hear this, and I really appreciate that you take your time and do it out of your free time like this, and actually not so free time because I know you're very busy, but you find time to sit down and make
Yeah,
this happen. Really appreciate you, George.
it's a virtuous cycle, and it's the more people are out there like you who see that there is a way to do good, like to do good in the world and also have business success. That's a big part of the message that we're trying to put out there. Like, you don't have to buy into the idea of being a greedy business person and you're being all about exploiting people. It's not about that at all. It's about solving problems and
Yeah,
using the solution, like the wealth that is created from the solution, to make more solutions. I mean, if you guys do well, you'll tackle other conditions, other problems, and that's beautiful. That's great for the whole world.
yeah, agreed.
All right, my
Thank you,
friend. I
George.
look forward to touching base with you in the future and seeing how you're doing.
Same.
Take care.
Take care, George.